What's going on, guys? Dr. Corey Choffner here, Doctor of Physical Therapy, as well as strength and conditioning specialist. We're coming at you this week with a new video on top of our lower back series for this month of April. This is our third video in our series. If you did not see the prior two, go back and watch because that's your foundation of where you want to start. Last week, we talked about how to identify disc bulge versus disc herniation in terms of what type of symptoms each present with and what to do about it. We went through the exact steps you need to take. So if you haven't seen that, go back, start with that. Tonight, we're going to talk about how to screen your lower back pain. So grab a pen, grab some paper, you're going to jot down some notes. We're going to open up with our 5 categories that encompass how to properly do and carry out a lower back screen. You can do this at home as long as you pay attention tonight and you jot down the proper notes and you ask the right questions down below in the comments. Okay, so let's dive in. Number 1 is we're going to go through screening tests. Okay, we're going to go through the tests that we encompass that make up a good proper screen so we don't miss anything and don't leave anything out. Number 2 is movement assessment. We're going through the exact tests that you should be looking at in terms of your thoracic spine and your hips as well as your lower back. Number 3 is mobility testing. So same thing, looking at your kind of areas above and below your spine and some of the areas at the ankle as well, because the ankle sometimes being extra tight can also lead to development of lower back pain. Number 4 is load testing. We're going to look at a kettlebell load tolerance test. It's going to tell us if you can handle the weight and if you're kind of putting too much pressure on that spinal canal and you shouldn't be doing things like running or deadlifting and vice versa. And then number 5 is coordination and strength testing. That is one thing we're going to look at that's a little more in detail, looking at single leg activity, okay? Because you need good coordination and strength in order to kind of make a good bulletproof spine so you don't have that pain come back or it doesn't become worse. So those are our 5 topics. Again, screening, movement assessments, mobility testing, load testing, coordination, and strength testing. Bit of a mouthful there. So pay attention here. We're going to dive into kind of how we do these and what we do. Okay. So number 1 is screening test. Number 1, first thing you should always do, and I tell all my clients this, it's no different for them. No, it shouldn't be any different for you, is get an activity log, right? So make your own activity log. You can use Google Sheets. You can use Microsoft Excel. You can use your notes in your phone. I really don't care what you use, but you're going to write down your activities, movements, and postures that bring out your symptoms. So say, for instance, like sitting all day at work tends to provoke your pain. You're going to write sitting in one column. You're going to write how long you're doing it for. So maybe you write 8 hours. Then you write on a scale of 0 to 10, how much pain you're in. 10, severe emergency room, 0 is no pain at all. So you need to go through each activity throughout your day and write it down. And I don't just mean like sitting or standing. I mean like stuff you're doing in the gym, stuff you're doing like at home, whether you're gardening outside in the back, maybe you're doing yard work. Those little repetitive micro trauma activities like washing the dishes or loading the dishwasher, those can also cause some kind of increased pain and symptoms as well. Okay, so that is number 1, activity log. Number 2 is posture assessment. So we need to look at your posture in sitting and standing, right? You can take pictures of yourself from a standing position, from a sitting position. You can have a friend do it so you don't likely correct yourself. But it's really important to see what your posture looks like. Do you have more of an anterior forward pelvic tilt? Do you have more of a posterior backwards pelvic tilt? Do you sit like this? Do you sit overextended like this? Right? Those are all important things that we need to address and look at in detail. All right. And then the third kind of thing here in screening test is seated pull test. This is where we add a little bit of load to it. So seated pull test is really simple. You're just going to sit on the edge of a chair. So you're going to scoot forward. You're going to use your hands, grab the bottom of the chair. You're going to sit nice and tall with good upright posture. And you're going to pull up on the bottom of the chair towards the ceiling. And you got to kind of write down or let your therapist know if you have any pain with that. Then you're going to try it flex forward. So you're going to really round your shoulders like you've been watching TV for a while. And then you're going to pull up and you're going to let your therapist know if you have any pain with that. And then the last test is you're nice and upright, chest tall. You're going to try and pull straight up with an overextended and arched spine with your chest up. And you're going to pull back. That's going to put you into one of 2 categories. It's going to either put you into an extension intolerance or flexion intolerance, but we're not going to dive into what that means. That's in our next week's video. So stay tuned for next week. We're going to go over the 4 classifications of back pain and how to properly treat them. Okay, so after seated pull test, you want to do prone lie test. All it means is you're laying on your stomach for 1 to 2 minutes. If you can't tolerate that, then usually it means that you have some kind of disc issue and you have an extension intolerance, which again, we'll dive into next week. Okay, and last thing, guys, is make sure you record yourself. Like record yourself doing these tests, record yourself with your phone on the side, going through a squat, going through a deadlift, because you can depict a lot of things from recording yourself. That's been the biggest game changer of me switching from doing things in person to kind of switching to doing and helping people online. All right, so that's screening test. Number 2 is movement assessments, where we're going to look at a body weight squat. We're going to look at a barbell back squat. Why are we looking at both? Because a lot of times people's form changes a lot when they're doing a barbell back squat. For some reason, putting that bar on your back tends to like change the way that they do things. Some people don't have a butt wink when they do a bodyweight squat. Some people have a butt wink when they put a bar on their back. It's just some kind of weird anatomy thing maybe, or something like mentally going on. But if that butt wink is where that pain gets kind of brought out, then we need to say you probably have a flexion intolerance and we need to do something about it. So we got to look at your form, maybe an overarched back, maybe you collapse forward too early. So that's why we're going to use the squat and break down some tests from there. All right, the next thing we're going to look at is barbell RDL, right, Romanian deadlift. So we want to see how well you do with that, where you kind of hinge about your hips. Sometimes people don't know how to hinge at their hips and they work more with their spine. So that's an important test to depict and go through. And then we want to look at a single leg squat. This is for advanced athletes. Single leg squat tells us a lot about how you move, how your mobility is at your knee, hip, and ankle, and how well you can tolerate it in terms of like how deep you're getting and how much you can get out of the bottom, or how much you struggle to get out of the bottom, I should say. Okay, so that's movement assessment. Number 3 is mobility testing. So we want to look at your thoracic spine and your hips. Those are 2 most important things above and below your spine. Thoracic spine means your mid-back, right? We want to look at your extension. So we can do the PVC wall test, where you kind of sit against the wall on the ground, make sure your head, your mid-back, and your butt are all touching. And you grab that PVC pipe, or you can use a broomstick or a golf club, and you try and keep your arms straight and try and touch the wall behind you. If you can't touch that wall without arching your back, it means you're probably really tight and restricted through your thoracic spine. You might have some tight lats as well. If you want to see if your lats are tight, you can flip your hands in a reverse grip and try the same test going up and over your head. So give that one a try. And then the next one we want to look at is rotation. So the next one, you scoot off the wall a couple feet forward, put that kind of PVC pipe across your clavicles here, take a crisscross position. We try and rotate to the right as far as we can, then rotate to the left as far as we can. You should be able to match the same amount on each side or get close to within 10%. And if you can't, or it's painful on one side, that might tell us something about your back, and that might tell us that we need to work on that thoracic mobility. All right, after that, then we move to the hips. And we want to look at your hip rotation. So you can lay on your back, bring your knee to about chest height or hip height. And what you want to do from here is we're going to look at internal and external rotation. So you want to kind of rotate your leg inwards as far as you can. That's external rotation. And you're going to rotate outwards as far as you can. That's internal rotation. And it might sound backwards, but you have to think about what's happening at the hip joint, now what's happening at the foot and the ankle. Okay, so do those tests. See, most people are restricted in hip internal rotation and thoracic extension. Those are the common patterns that I tend to find with people with back pain or people who develop back pain. Right, then the last thing for mobility testing is ankle mobility, right? Ankle mobility needs to be looked at in specific, right? Because a lot of people don't have good ankle mobility because they don't spend a lot of time in a deep squat, they don't spend a lot of time in deep lunges, or they don't do any of that type of activity. A lot of them sit all day. So they never really work their ankle joints, so they get really stiff and locked up. So you want to look at the 5-inch wall test, which we've mentioned many times before in our previous calls. If you've been following us since January, you can go back and see, we talk about the 5-inch wall test in detail for Achilles tendonitis. This works as well for back pain. If you don't have good ankle mobility, your trunk is going to collapse early in a squat. And the further your trunk collapses forward during a squat, the more pressure typically goes through your L4, L5, and S1 vertebrae of your spine. So that's a super important test. Okay, so that is mobility testing in a nutshell. And then number 4 and 5 here coming up is load testing. Right, we want to go into load testing next. Look at the kettlebell load tolerance test. You can use a dumbbell or a water gallon if you wanted to for this too. This one's going to show us how well our spine handles stability, so to speak, right? So how stable is our spine to kind of handle forces thrown at it? That's a super important thing we want to kind of look at and address here. With this test, what we're looking at is we're holding a kettlebell against our body. We're going to keep straight arms, and we're going to try and bring that kettlebell up to about chest height. You're going to do 2 to 3 deep breaths. And you should not have pain with that if you have a nice, strong, stable spine and those muscles are working around your vertebrae. If you do have pain with that, that means you have a load intolerance, meaning you should not be kind of doing any heavy-duty weightlifting. You should be doing very lightweight squats, very lightweight kind of barbell deadlifts, because if you do kind of throw load at your spine and it's not ready to tolerate it, you're going to pay for it, okay? It's going to make things worse. All right, and then the next test is heel drop test. Heel drop test is just a heel raise. You're going up on 2 kind of heels, right? So imagine you're doing a calf raise, then you drop aggressively down to the ground. So up on 2, down on 2. And if you have spine pain with that, that means you have a load intolerance as well, meaning you probably shouldn't run, you shouldn't do any jumping quite yet. You have to build up your strength and your stability and work on your mobility first. Okay, those are two very, very important tests that come kind of number 4 here. And then number 5, as we wrap up here, coordination and strength testing. This is a very important part as well. This can be kind of encompassed under balance as well. So single leg bridge test is a great test to do. You lay on your back, both arms up in front of you, kind of up towards the ceiling. All the weight's on your right side, your left leg's off the ground. Try and push through your left leg and try and get your hips as high as you can off the ground. So that's going to tell me how well your glutes are functioning, how well your core is working. A lot of people can't get super high, or their pelvis will twist and rotate in that transverse plane. And that's going to show that you need to work on your strength and stability. Usually it's your glute medius muscle or your glute maximus, and that's going to help you build up good tensile strength so your back doesn't take a lot of the brunt of the load while you're doing things throughout the day. I don't mean just exercise, I mean like daily simple things like getting up out of a chair, getting off of the ground. Say you're playing with like your son or your daughter, playing with your dogs, right? Super, super important. And then you want to look at a single leg squat that's a little more advanced, like we mentioned before. It's going to show us your hip, your knee, and your ankle mobility. And it's going to show us your strength, meaning your ability to kind of control it as you lower while staying in a nice kind of straight plane of movement, and how much kind of, or how easy or difficult it is to get out of the bottom. That's going to show us how much strength you have there. Okay. And the last one is single leg deadlift. It's almost like a hip airplane, if you've ever heard of that before. All the weight's on your right side, left leg's going behind you. Your trunk comes down, you can actually touch the ground or have both arms out to the side. You're going to return back to start. So we want to look at your feet during that. We want to see how well your feet are functioning. If they're moving around a lot, it means they're unstable. And we want to look at your knee joint. If your knee joint's bouncing left and right, like repetitively, that means that your glute med muscle most likely is weak, or your quads have a little bit of weakness. And we got to work on those and do some other tests to address those. But we've thrown way too many tests at you already, so we're not going to go down that rabbit hole. So those are the 5 tests. So screening tests, number 1, movement assessment, number 2, 3 is mobility testing, 4 is load testing, and 5 is coordination and strength testing. So it's a lot. So go back and watch this again, pause it where you need to, take some notes. And guys, you do not want to do this by yourself. You can have a healthcare professional with you to guide you through it, or you can have someone with a kind of camera next to you, or they're using your cell phone recording you. Then you can kind of review it together. I do recordings with people on Zoom just like this. I'm using Zoom right now, so to speak, and I record them during their assessment, and I show them what they look like. And then I break down kind of what they're doing and why it's important that they don't do it anymore and how to fix it. That's super important. That video feedback and verbal feedback mixed with it just goes a long way, and it's very different than in person, because a lot of times people go to PT and they get so confused and overwhelmed, and they just get kind of depressed in a way because they don't see themselves changing, and things get worse and worse because they don't see what they're doing, and sometimes they're not doing it properly. They're not getting enough time from the therapist. So this is why it's super important to kind of see yourself doing these things. All right, I'll get off that pedestal there. So if this sounds like you, comment below with what you've tried to eliminate your lower back pain. I want to know, maybe I can help, maybe I can refer you to someone who can, or a good resource that you can kind of attach to. This is the 3rd video again in our lower back series. If you haven't seen the first 2, go back and watch. Thank you guys so much for watching so far. If you found this valuable, please be sure to like and subscribe. Comment down below if you did like it, or if you didn't like it, let me know. I'm open to feedback. I love feedback from you guys. And then also don't miss our next video coming up, our 4th one in our series for lower back pain, and how to classify your back pain and effectively treat it. All right. Thanks so much, guys. So long for now.